Hi, it's Dr. Jared Yevans at Sewickley Chiropractic Center today. What I want to talk about is some of the common mistakes patients make when they have a disc bulge or disc herniation, and then I want to talk about some easy solutions to help you to get through those tough acute phases when you have that disc bulge or disc herniation. The thing that I see most patients do most commonly, and the biggest mistake that they often make, is a lot of patients, when they get lower back issues such as a disc herniation or disc bulge, they go right into flexion style stretching. So in other words, their back hurts, it hurts down the legs, it hurts into the feet. What they instantly start doing is they start bending forward at the waist like this to try and stretch it out. In some cases that works. In other cases, it's actually going to make the situation much, much worse than it already is. What you want to look for instead is something called centralization when you have a disc problem. What that means is when we have a disc problem that causes sciatica, we expect to see lower back pain. We also expect to see pain down one of the legs, if not both of the legs. Oftentimes it can go all the way into the bottom of the foot. So centralization simply means that that pain moves from the periphery of the body, so the foot or the leg, and centralizes into the lower back. So in other words, if we have sciatica from a disc problem and we bend forward and it makes the pain worse or shoot down the legs, that's called peripheralization. If we do that same motion and the pain decreases and goes into the center of the back, we call that centralization, and that's a good thing. So while some patients do better in flexion, most patients with discs actually do better in extension. And there's a whole series of exercises called the McKenzie extension exercises. These are what you want to start with and try to see if you can achieve centralization. So I'm just going to show one or two of those that are simple and easy to do at home to see if it can give you some relief. So when we talk about McKenzie extension exercises, the first and the easiest is to just lay on your stomach just like this with your head to one side or the other. Let me scoot a little further back here. And what this does, this puts your back into mild extension, okay? And what this does, this helps us to see if this allows for peripheralization or centralization. And again, we're looking for centralization. We want the pain to go into the spine, not away from the spine and down the legs. So we hold this position for about 1 to 2 minutes. If the pain stays the same or if the pain improves, that's a good sign, and we can move to the next step. The next step is super easy. We just get a pillow like this, put it under our chest and our head like this, and that puts us into a little bit more extension. Same rule applies here. 1 to 2 minutes, laying, relaxing, and extension. If it improves and centralizes, great. If it doesn't and it gets worse, we have to stop doing the extension exercises. So let's assume that it gets better. After 1 to 2 minutes of laying like this, we can move into the next step. We get rid of the pillow, hands are at the side, and we put our body into more extension, just like this, and we hold this position for 1 to 2 minutes. In a lot of cases, these simple extension exercises will actually improve the symptoms that you have with sciatica and disc problems. If for whatever reason these exercises make it worse, we want to discontinue them immediately, and then we move into more of a flexion pattern to see if flexion and bending at the waist and doing things like knee tucks and knee to chest type stretches actually help it more than the extension exercises. Hopefully this helps and gets you some relief through some tough times with sciatica.